We want to say good morning now to Dr. Kent Holtorf. And Dr. Holtorf, we thank you for coming in this morning to help us with some questions. We just saw this about masks. Would you recommend masks for your patients?
Well, the problem is about 80% of the infections are transmitted via hands. So basically someone sneezes, it sends out millions of particles on doorknobs, on countertops. People touch those, and then they end up touching their face. So that's 80% of the time. So really the mask may help if it stops them from touching their face, but actually it may even make it worse because people take the mask on and off, and so it can increase transmission that way. So really, it's only going to protect you if someone sneezes right in your face, but really hands are the biggest key.
Hey, doctor, you and I were talking a couple of minutes ago, and I thought this had something to do with flies on the pigs, but you said it really has more to do with the pigs being on top of each other, just crammed in together in little pens.
Right. Well, what these are, this is the H1N1 virus, and that's the genetic makeup of the virus. And really, it's an RNA virus which mutates very quickly. So we're made of DNA. We actually mutate very slowly. The DNA viruses mutate slowly, such as the polio virus. That's why we've been able to eradicate it. But the RNA virus, again, mutates very quickly. But the key is the pig is very unique, and it can actually harbor the pig virus, the human virus, and the bird virus at the same time. Very unique. And what happens when you have a lot of these pigs all crammed together, it's like a big incubator. So you have this very quickly mutating virus that has bird, human, and pig virus in it, and it basically is churning out all these different variations and new strains. Now, normally, a new strain is not going to be an advantage for that virus, and it just dies off. But 1 in a million, 1 in a billion, all of a sudden, it's an advantage. But even then, it wouldn't make a difference unless the pigs are all basically crammed together. Now it can actually take hold and outcompete some of the less virulent strains. And so it's really putting these pigs in these close quarters and massive pig farms that is causing a problem. And the more compact the pigs are, the more likely it is going to be a very deadly virus. So even, in nature, let's say you get the flu and it originated from migrating birds. It's usually very mild. If originated from birds that are chickens that are all crammed together, potentially very deadly. So really, it's really the way we treat these pigs, so it's kind of revenge of the pigs that's going on here.
All right, practical questions from our viewers now, Doctor. This is from a woman. I'll give your name away. You may give away your party, but Michelle, I have a surprise birthday party for my husband, planned to leave on Thursday to Cabo. Should I cancel it? I didn't purchase travel insurance.
Well, it's recommended to not do any non-essential travel to Mexico. So, whether that's essential or not is a judgment call there. But
right. It is, but is a party essential?
Well, that's the question.
Yeah.
You know what? Yesterday, my daughter has a sniffly nose, and she's not been eating a lot. All the symptoms that seem to be on this swine flu. So I called up the pediatrician, and they said they're getting inundated and not to worry. So how do you know the difference between what's a normal little flu and the swine flu?
Well, you really don't. And the nice thing is the swine flu has seemed to kind of peter out. It's lost its virulence. And so really, most people that get the swine flu won't know the difference. Probably just mild. Wouldn't call the doctor unless you have significant symptoms or have significant risk factors for, since you're very old or have some illness that would make you more likely to be hospitalized due to the flu.
All right, from Christy. My teenage son has come down with a cough and a fever. We live in Huntington Beach. There aren't any pigs around. Should I be worried?
No. Again, it's very the small amount of swine flu here in the area. So I wouldn't worry. Just treat it as usual. Try to limit your exposure to others, and really prevention is the key right now.
Would you advise people to stay away from places such as movie theaters, etc.? What would you do?
Well, really, it is to limit your exposure, and the problem is, again, when someone has, there's basically flu virus on the counters, it's the hand washing, that basically it can stay alive for about an hour, and so the key is hand washing and avoiding unnecessary social contact. Unfortunately, a handshake is, very socially acceptable here.
Absolutely.
So, that is a problem.
All right, more of your questions. Dr. Holtorf will be back with us in an hour. News comments at fox11.com. He'll be back with us. and we'll have more of that. There's so much more to talk about here. We'll try to get to more of your questions as well.
He said something really important, though, that it's becoming milder, especially in the U.S., becoming milder.
Yes. Maybe we'll talk more about that, because the issue is mutation. Will it mutate somewhere else in a hardier way? We'll see.